Suicide prevention is a paramount concern in Suffolk County. Dr. Max Banilivy is a clinical psychologist at the Pederson-Krag Center and is a member of the Executive Committee of Suicide Prevention Coalition of Long Island. He joins us today to talk about suicide prevention. Thank you, Dr. Banilivy, for joining us today.
Thank you for having me.
Dr. Banilivy, the need for suicide prevention is obvious. Can you give us some basic statistics on suicide, please?
About more than 38,000 Americans take their lives by suicide nationally that we know of. About at the New York State level is about 1,300, and locally in terms of Long Island there's less than about 190 or so people that, as of last CDC statistics, that we know that would take their lives by suicide, but we also know that that's a gross underestimation.
Okay. And I gather with returning veterans and all the attention to suicide among returning veterans, that's contributing as well.
That is definitely contributing, and certainly the economy is contributing. So those are two of the main contributors to a rise and increase in terms of, and I'm sure the community hears about that or finds out about those suicides, and certainly with regard to the veterans, that has been very public.
Yes, yes. And I know that on Long Island we have a suicide coalition that you're understandably very proud of. Can you talk about the membership of the coalition and what the main goals are?
The goal that we started the coalition number of years ago, it was to serve as a way of getting the community together in Nassau and Suffolk County as a bi-county region, and in that context, continue to generate ideas, needs for the community, and develop subcommittees for youth, for certain stakeholders, and so on, to go forward. Disseminate information to the community about what we're doing, what are the things that are available, what kind of trainings, what kind of education, where to go for resources, and so on, but benefit from pulling in more and more community members to being part of the coalition to continue to meet that goal.
So the coalition really looks to grow and involve as many people as possible and entities.
Absolutely.
Now, I know there are member organizations. Are there any programs in particular that you think are particularly innovative or something that people would benefit from knowing about?
Well, programs, I guess one of the things that we have established has been the website.
Mm-hmm.
That is really was because that is a context where a lot of information, a lot of resources, there's a lot of education. So we, as a living document, we meant that to be an evolving document where people can interface with, give us feedback, and benefit from what is there already. So we would like that to be utilized as much as possible, and there's a counterpart of that at New York State level. I'm going to mention both of those websites. For the website for Long Island region is preventsuicideli.org, and the one for New York State is preventsuicideny.org. About 3 years ago or so, New York State established a suicide prevention center as a result of a summit that's established, and that they have been at the forefront of rolling out many resources, many educational things, many events and programs statewide.
And I know that one of the member agencies, Family Service League, has a project known as Joe's Project.
Right.
Can you talk about that a little bit?
It's a wonderful program, and it's just actually is easily accessible, and it's available through Family Service League, and it's a 24/7 type availability for anyone who may have concerns about suicide, or any survivors that may be concerned with any question. They can contact Joe's Project directly, or that they can go back to the website, and then they can still get some of that information. Plus, the American Foundation Suicide Prevention chapter on Long Island afsp.org is a website that absolutely to go to, particularly for survivors.
Mm-hmm. And I know that it's been your feeling, as well as the members of the coalition, that to help prevent suicide, you don't have to necessarily be a professional. You just have to be a person that's aware and that talks about these things and asks questions. Can you talk about how a viewer might be able to see themselves as suicide alert and what that means?
I think just getting some of that information, the first step is for them to go to the website, just learn, just on their own, at their leisure. The second is to benefit from some of the we call gatekeeper, community-based educational trainings that are available at this point that we can roll out anywhere. All they have to do is contact through the website, and that would be another way where they would find out that indeed you don't have to be a professional, they have to just have an interest, have a passion, have a willingness to wanting to learn some basic things and to shed the myths about suicide and suicide prevention and about people who think about suicide. And I think those are good starting points.
Mm-hmm. And what would be your thoughts if somebody is at all concerned about somebody? Should they talk about it? Should they ask questions? Or would that somehow encourage suicide?
Right. I think that's, we know that has been a long-standing myth and still is. We know that, and we work very hard at trying to shed that myth and by education, letting people know. We know for a fact that asking people directly about suicide actually helps. Mm-hmm. So I think people to help themselves get more comfortable with asking directly when they're worried about someone. When we do, and when I do some of the trainings, and I'll ask the audience all the time, think about somebody who is in your life that is going through a lot of stress. Do you know if that person has thought about suicide? Mm-hmm. And most people say no. Right. And the reason is, well, I haven't asked, because that's an awkward thing to be asking Absolutely. About a serious matter.
Yeah. Okay, well, thank you very much. You mentioned the website for the coalition. Is there a phone number also in case somebody's more comfortable with that they might be able to call?
Absolutely. Mm-hmm. They can call. My number is 631-920-8039. Mm-hmm. They can call that number. And so also there are many resources at the Long Island Field office. I think that number is 761-2508, the main number there. Those numbers are also the mental health associations, particularly the Mental Health Association in Suffolk County. Colleen Merlo is the executive director. She's a tremendous resource. I don't remember the telephone number offhand, but it would be easily found. I think those three entities will be able to respond very quickly, usually.
Thank you so much for joining us today.
My pleasure. Thank you.
Thank you.